Well, good morning, everyone, and welcome to the Carlos Rosario School. So very glad to have all of you here. A very warm welcome on this chilly day for all of us. But it is so worthwhile being here, and a very special welcome to our amazing mayor, Muriel Bowser. Leading our district, making sure residents have access to quality education like the Carlos Rosario School and really quality health care. Our school is a national model for adult education. As I think you all know, we're serving 2,000 students at 2 campuses here in Washington, D.C., gaining their high school diplomas, gaining career certifications, and then going on from our school and flying and thriving and becoming business owners and community leaders in their own right. And so this school is a quality school and a school of excellence, but not just a school. We are a community hub. And that's one of the reasons we were so honored to be asked to host this press conference today, because we do more than education here, but we help connect people through fantastic partnerships, like with DC HealthLink, with the services and the resources that they need so they can persist in their education and in achieving their goals. And that's why for the past 4 years, we have been partnering with DC HealthLink to provide enrollment locations here at our school every year, and over 400 people have enrolled. So again, a warm, warm welcome on this chilly day to the mayor, to your amazing team, to the DC HealthLink team. We're so glad to have all of you here.
Good morning. I am Mila Kaufman, the Executive Director of the DC Health Benefit Exchange Authority. Thank you for joining us this morning as we officially announce open enrollment for 2018 through DC HealthLink. I would like to thank Allison and Carlos Rosario International Public Charter School for hosting us today. They have been a partner with us from the very beginning, and their support is important to our efforts to reach the Hispanic community in the District of Columbia. I also want to thank the staff and board members of the DC Health Benefit Exchange Authority who are here today. Without their expertise and personal commitment to standing up the district's health insurance marketplace and their commitment for universal health coverage, none of this success would be possible. Thank you to our sister agencies. Thank you to our sister agencies for their extraordinary efforts fully implementing the Affordable Care Act here in the district. Wayne Turnage, Director of Department of Healthcare Finance. Laura Zeilinger, Director of Department of Human Services. And Stephen Taylor, Commissioner of the Department of Insurance, Securities, and Banking. On behalf of the DC Health Benefit Exchange Authority, I'm proud to join Mayor Muriel Bowser today to launch open enrollment for health insurance through DC HealthLink. The Health Benefit Exchange Authority is responsible for DC HealthLink, the online health insurance marketplace for district residents and small businesses. DC HealthLink opened for business on October 1, 2013, one of four states to open the marketplace on time. And we have been here since day one and are going strong. We provide stability, choice, and options to fit all budgets in the face of uncertainty in parts of the country that rely and have to rely on the federal government's insurance marketplace. We don't rely on the federal government. We're locally established, locally managed, and locally operated. We were built from the ground up with policy developed by diverse stakeholders reflecting the priorities of our community. And many are here today. Maria Gomez, Jay Haddock, Jackie Reyes, and so many. We advocate for all our customers for private health insurance options to fit every budget. We have 26 health plans from Kaiser and CareFirst, Blue Cross Blue Shield for 2018 for families and individuals. And of the 26 plans, 15 called standard plans were specially designed to make sure that you can see your doctor, your specialist, your mental health care provider. You can even go to urgent care without meeting your deductible. And we will continue to advocate for our customers to make sure residents have the best possible options at the best possible prices. While the Affordable Care Act continues to be under assault at the federal level, here in D.C., we are united. Just look around. We have city officials, community leaders, all here to support the Affordable Care Act and open enrollment. We're all committed to the goal of getting every child, every person living or working in the District of Columbia covered. And while the federal government shortened its open enrollment period to 6 weeks, we acted to keep our open enrollment open for 3 months. While the federal government has slashed funding for their navigators, trained experts who help people with enrollment, we've maintained our commitment, and we will be all over our city for the next 12 weeks, making sure we find people who don't have health coverage and we get them enrolled. The Affordable Care Act has helped thousands of district residents, and today, a few of our current and former customers are here. Victoria Lay, Casey Blaylock, and Tracy Craig. Please come up. I'm proud to introduce our next speaker, DC HealthLink customer Tracy Craig, who is a self-employed consultant and who has a pre-existing condition and was considered uninsurable until the Affordable Care Act. Tracy, please share your story.
Hello. My name is Tracy Craig, and I have been enrolled with DC HealthLink for over 3 years. As someone who is self-employed and who had been told pre-ACA that I was uninsurable for what was considered a pre-existing condition, I am very grateful to the ACA for making it possible for me to have access to comprehensive medical coverage. I am particularly glad that I live in DC and am able to utilize the excellent local health insurance exchange, DC HealthLink. Late last year, I was especially grateful for my health insurance when I was unexpectedly faced with a potential cancer diagnosis. Thanks to the ACA and DC HealthLink, I had access to the care I needed, including consultations and scans, surgery, and important follow-up care, all of which have allowed me to return to living a productive and enriching life. Without access to health insurance, it is possible I would have been denied some of the care I needed. If I could have obtained care, however, attempting to pay for that care without insurance would have wiped me out financially, requiring more money than I have in savings or could make in well over a year. It would be an exaggeration to say I am alive today because of the ACA, but without the diagnosis and treatment I received late last year, my life would be very, very different. DC HealthLink and the other healthcare exchanges are invaluable to tens of millions of Americans. They are especially important, however, for those who, like me, do not have an option of employer-based health insurance, such as self-employed contractors and consultants, or those working several part-time jobs. DC HealthLink and the other exchanges provide us with essential access to comprehensive medical coverage and care. Thank you.
Thank you. That is why we do what we do every day, fighting and advocating for the Affordable Care Act for all of our customers. Now, it is my honor to introduce the Honorable Mayor of the District of Columbia, Mayor Muriel Bowser. She's a woman on a mission for the residents of our great city. She's a woman who believes that every resident should have equal access to services this city offers. She's a woman who believes in inclusiveness. All are welcome to the table. She's a woman who works tirelessly to make sure district residents have opportunities. She's a warrior and a fighter for the city we love and makes DC proud. Ladies and gentlemen, let's welcome the Honorable Mayor Muriel Bowser.
Thank you. Well, how about that? Hola, buenos dias. Me llamo Muriel Bowser, alcaldesa de Washington, D.C. It is fantastic to be here at the Carlos Rosario Public Charter School. Let's hear it for Carlos Rosario. 2,000 students on their pathway to the middle class right here in the best city in the world. I couldn't be more proud of the work of Carlos Rosario, now on 2 campuses, serving Washingtonians who want to work hard, play by the rules, play fair, get a job, raise their families just like everyone else. And that represents the best of DC values, the best. I am very proud to be here with the Health Benefits Exchange. Mila Kaufman, thank you for your outstanding leadership. Let's give Mila a big round of applause. You heard her talk about why our Health Benefit Exchange has been excelling since 2013. Started on time, one of only 4 exchanges in the nation that can say that. We're working hand in hand with our residents to make sure that each and every person has access to high quality health care. Now, we have a lot of things that we can do in life, go to school, get a job, but there's really not a lot you can do without your health, right? And we can't always say what's coming at us health-wise, can we? But we can always be prepared. That's why we are very proud in our city that just about everybody can have health insurance, right? So why don't we have 100% of people signed up? So that is why we're here today. We're here today to encourage everyone to go to dchealthlink.com. Open enrollment means it's sign-up day, and it starts today. Open enrollment until January 31st means you have 3 months to sign up. But why put off till tomorrow what you can do today? So I'm here to encourage everybody to get signed up. You've already heard Mila talk about our great team all across DC government. It's not just DC Health Link's job to get people signed up, it's everybody's job to get people signed up. And so I'm very happy that members of my cabinet who are here, they all work together to make sure DC residents are healthy. So Wayne Turnage and Laura Zeilinger and Stephen Taylor, thank you very much for the work that you are doing. I also want to recognize our director for the Office of Latino Affairs, Jackie Reyes, who is here. Thank you, Jackie, for your leadership. Mamadou Samba from the Mayor's Office of African Affairs, and David Doe from the Mayor's Office of Asian Pacific Islander Affairs. Thank you for all that you are doing as well. So you've heard also that we're a little bit different. You hear things about repeal and replace and Obamacare is bad. Ignore all of that. Because today, what are we doing? We're signing up for health care in Washington, D.C. We believe that health care is a right, not a luxury. We believe when people have access to high-quality health care, they won't wait to go to the doctor. And if there is something wrong, you'll find out early. And the earlier you find out, the better you are able to fight any ailment. We also know that people won't let ailments get bad and then end up in an ambulance or at the hospital. Instead, they'll go to their primary care physician. We know that you will look at your little ones at home. They all should be signed up. They all should have insurance. They shouldn't be at home with the sniffles if they can go to the doctor. They shouldn't let little ailments or things that you may not know about wait until the emergency room when you can be at your primary care physician, right? Am I right, Mila? Because we know when you have a regular doctor, you can live a healthier life. Are you with me? Who's with me with this? I don't want you to have to get in an ambulance, right? Because if you're in an ambulance, you should really be having an emergency. And if you are not really having an emergency, you can go to your primary care physician. Let me just say a little bit more about how we got here. In Washington, D.C., we're very fortunate to have a world-class health system with great doctors, hospitals, nurses, and other medical experts. We have great health care providers also in our schools. And so it is an important part of everyone's job in district government to ensure that regardless of your background, your zip code, your immigration status, or your income, that you have access to these great services. So when the Affordable Care Act was enacted in 2010, some people call it Obamacare, we left at the opportunity to provide health insurance for more uninsured residents. We set up a state-based marketplace, we call it DC Health Link, to help us build up more insurance coverage in DC. Today, more than 96% of Washingtonians have health insurance. But you know what? That's not good enough. Our goal is 100%. Of those Washingtonians, more than 18,000 of them are insured through the DC HealthLink individual marketplace, and more than 76,000 are covered through the DC HealthLink small business marketplace. So I want you to know that our team at DC HealthLink is made up of outstanding professionals who are there to help. Sometimes these things can be confusing. They've made it as easy as possible, but they also have people there to assist you if you get on the website and you have questions. I've talked about our enrollment goal already. Our marketplace is alive and well. It's open for you. We are ready, willing, and able to help you with any questions that you have. You should go to dchealthlink.com. You have until January 31st. But once again, why put off till tomorrow what we can do today? Sign up for health care in Washington, D.C., because when I see you out there, I'm going to ask you, did you sign up? Did you sign up? Did you sign up? Did you sign up? I'm serious. Did you sign up? dchealthlink.com. Have a great day, everybody. I scare easily. All right, so I think that we have a few minutes for questions from the press on DC HealthLink. Any questions? Any questions? Yes, Sam.
So, Mayor, obviously the Trump administration is against this, and they've done some things that I understand has made it difficult to sign people up. I mean, for example, cutting weekends. What effects have what the Trump administration done? What effect is that having on the situation here in D.C.?
Well, I'm going to ask Mila to talk. She mentioned some things that the federal government has done that we are not doing here in D.C., and I'm going to ask Mila to talk about that. And if Wayne has anything else to add about federal concerns, we will do that.
Okay. Thank you. So you're absolutely right. The Trump administration cut open enrollment in half and decided to close their site every weekend. Who does that, right? We didn't do that. We expanded our open enrollment to 3 months, and we're open 24/7. So we have protected our residents' access to affordable health insurance by having a local state-based marketplace, and we can do those things. And we're open 24/7, dchealthlink.com.
And with all the efforts, against the program by the Trump administration, are people reluctant to sign up given all of this that's going on? And what would you advise?
We are open for business 26 different health plans to fit every budget, free help available. Please don't worry. We are here. We will advocate for you. There's strong support from the mayor. There's strong support from city officials, and we will be here making sure that our residents continue to have access to affordable health coverage. Please don't wait and enroll.
Final question for me.
Let me just add, Sam. I think your sense is our sense, that we know that people are getting mixed messages. They see one vote here and they don't know what it means. They hear about repeal and replace. They hear about less money and they don't know what it means. So part of our message this morning is it has had no impact on us, and you should sign up today. And if there are any questions, we'll figure it out once you call. But don't try to figure it out and don't call. Call us and we'll figure it out together.
Finally, apparently, I heard the Massachusetts program has something to do with D.C. Could you explain that to us?
Well, they have some. Well, I'll let Mila talk about that.
Thank you. We have a first-in-the-nation state-based marketplace partnership with the Massachusetts Health Connector. Our DC HealthLink technology worked so well for our residents, for our small businesses, that Massachusetts wanted us to replace their technology for their small businesses. And so we did that. And we will be operating their small group marketplace for the Massachusetts small businesses once it's fully open for business. So we're very honored that Massachusetts chose us to partner with.
Any other questions? Questions? Any off topic? Yes?
Spending any additional money to make up for the spending cuts at the federal level on outreach efforts?
We are committed to maintaining our current levels of funding for paid media as well as for our navigators and assisters. We believe investing locally to helping DC residents is critical. Now we're in the process of building our FY19 budget, and we will be increasing our spending on more outreach. I'm very concerned. We know from our internal surveys that 50% of our customers learn about us through healthcare.gov. So when the federal government slashes their funding by 90% for their outreach and enrollment, we're worried that that will have an indirect impact here. So we're being creative this year. We're asking all of you to help us spread the word, and we will be investing more.
Okay, thank you very much. I think we're going to walk inside and have a demonstration, is that right, of how you sign up. Thank you, everybody.